Okay, so thank you for the opportunity to present today. My name's Alicia Gibb and I am from MND New South Wales, and I'm the manager for FlexiQuip, which is our equipment loan pool. Up on the screen you'll see a bit of an overview of what we're going to go through today. I will skip through a little bit of it because it has been repeated over the last couple of days, but I want to have a bit of a different look at things from the angle of environmental sustainability and access to an equipment loan pool. So I'm going to start with some background. So for some of you who may not be aware, MND New South Wales are a service that provide information, support, education and equipment to not just people with MND, but also to their families, friends and carers. And we cover New South Wales and the ACT and the Northern Territory. So to give some context, the combined population of New South Wales and the ACT, or Australia's Capital Territory, in the green is 8.6 million people, and we cover a land size of 800 square kilometres just in the little green section. So this is, by comparison, the same amount of people in all of Switzerland and 20 times the size. Up in the little bit, the yellow at the top, we have 250,000 people, and those people are spread out over 1.25 million square kilometres. So our land size is very large. MND New South Wales have 753 participants over this 12-month period that I've looked at the data. The average age of people accessing our service was 65 years of age. And I won't go into too much detail, but we do have a very different system for people over the age of 65, which is the aged care system, and people under the age of 65, which is the National Disability Insurance Scheme. And unfortunately, what people can access under these two different funding schemes is vastly different. So let's start with what we do know about MND and assistive technology. So we all acknowledge that people with MND will have a change in their function, and there's lots and lots of literature out there that demonstrates that people with a disability will have improved quality of life and independence through access to assistive technology, focusing on their own choices and improving what's important to them. So the progressive nature of MND isn't conducive to waiting months and sometimes even years for funding bodies. And we also face the barriers within Australia, and I'm sure in other parts of the world, where within regional and remote communities we often don't have therapists that are accessing these areas. So to overcome some of these barriers, MND New South Wales established FlexiQuip. So as I said, FlexiQuip is the equipment loan pool. It's a service that covers New South Wales, the ACT and the Northern Territory. And it was started in 1981 with just 4 manual wheelchairs. And over the years, it's grown as a service, and 10 years ago was rebranded to be called FlexiQuip. So we focus on providing both high and low cost equipment to people with a progressive neurological condition, such with our primary focus being MND. There's also other MND organisations within Australia that provide some of the largest non-for-profit equipment pools throughout the country. So New South Wales and Victoria being the two biggest services within Australia. So as I said, there are different services throughout Australia, and each state offers something slightly different, but the focus is to provide assistive technology to people in a timely manner, to improve quality of life through the use of assistive technology, to meet the high and changing needs, so to be able to swap equipment in and out as people's needs change, and to improve the cost effectiveness and the wait time that we're waiting for funding bodies, and to improve the environmental sustainability by having this hired service model of care. So I'm going to go through some results over at the last financial year. In Australia, our financial year is from the 1st of July 2022 through to the 30th of June this year. So all of the results I'm going to discuss are based on this last 12-month period, and the focus will be on access to assistive technology, quality of life, and environmental sustainability. So as of the 30th of June this year, FlexiQuip had 2,284 pieces of equipment, which were worth over $4 million. The FlexiQuip product range has a primary focus on activities of daily living, with communication and environmental control as well. As you can see in the graph, we have grown very rapidly in the last 3 years. We've grown by 49%, and that's been really important to be able to have equipment readily available to provide to people in a timely manner. So within this review period, within this 12 months, we provided 2,786 items of equipment to 465 different individuals with motor neuron disease. So some of these people had used the equipment longer term and had been using it prior to this financial year and still using it in this period, and 1,840 new pieces of equipment were requested in this period. The equipment needs of people with MND vary greatly between diagnosis and death, and we do know that the phenotype and the rate of progression does have an impact on how much equipment people will access. However, what we found is, on average, people were accessing 8 pieces of equipment, and that ranged anywhere from 1 to 34 pieces of equipment. Interestingly, what we did find is that people under the age of 65 had higher assistive technology needs, on average accessing 13 pieces of equipment through our service, in comparison to people over the age of 65 who are only accessing 8. So now that we have a bit of an idea of the size of the equipment pool that we're talking about, we can have a look at the cost effectiveness. So within the last financial year, of the 2,786 items of equipment, if these had have been individually purchased by people, it would have cost a massive $4.6 million. The majority of our funding is through, the 57% is through charity, bequests, trusts and grants like Fight MND, and that means that 57% of people are not paying anything to access our equipment. The other 43% is still not charging the individual, it's charging to the National Disability Insurance Scheme. So that 43% that's made up in there, we charge a fee of up to $2,500 a quarter to access any of the equipment in the equipment pool, and that's charged to the NDIS, and that accounts for some of the funding, so about $684,000, which we obtained during that 12-month period to help support the program for everybody. And due to the way the aged care funding is, at this point in time, it's not something that we would be charging because there's just not enough money in their packages of care. So like any organisation or program, there's a number of expenses to run an equipment pool of this size. Our largest expense is the wage of the 5 part-time staff members we have, which I won't disclose in this forum. We also have another large expense is the purchase of equipment. Now this varies from year to year and it's largely supported by charitable donations and by grants such as Fight MND. I've highlighted our land size just to give some context to this next point. So one of our big costs is our courier cost. Now, our land size is huge that we cover, and that accounts for nearly $250,000 in delivery fees. To help with bringing down some of these delivery fees, we will be having our own van next year to help with some of the metropolitan deliveries. The next major cost is all of our equipment has to be cleaned, serviced, repaired, and that was around the $73,000 mark. Now that's probably underrepresented here because we have had a large injection of new equipment, so it is lower than it has been in previous years. So as you can see in a very quick snapshot, the costs of what's going out are significantly smaller than the $4.6 million worth of equipment that we've been able to provide. So I'll now move on to the environmental benefits of our program within FlexiQuip. So in a world of fast fashion and single-use items, we don't want disability equipment adding to the landfill. We want to be able to have equipment that meets multiple people's needs and not just a single user. Unfortunately, the type of waste that we can see up on the screen, it's not unique, it's not isolated to Australia, and it is a global problem. We want to be able to repurpose this equipment to have better impacts for people with disabilities and also on the environment. Within FlexiQuip, we are regularly offered donations of equipment. A lot of this equipment is either brand new and has arrived too late through funding bodies or in very near new condition. This last financial year, we were able to accept 125 items of equipment worth $645,000. Now, 58 of these items went into our general equipment pool, and another 67 items, which accounted for $500,000, allowed us to establish what's known as our one-off equipment pool. It's a sub-pool of equipment that's got some very highly specialised devices, and we've been using it as a little bit of a pilot program. So when new equipment comes in, we can trial it through this way with a few users, we get feedback, and then that's helped us to build and expand our pool of equipment. We aren't always able to accept all donations of equipment, so we do have limited storage space, but when we aren't able to accept donations, we'll always look at on donating or recommending other places where the equipment can be used. So just like our mobile phones, unfortunately, equipment doesn't last forever. So there is going to be an element of equipment that needs to be retired. Last financial year, we had 323 items of equipment that were retired due to either wear and tear or becoming obsolete. We were, however, able to repurpose 26 of these items up to the Northern Territory. So we aren't able to provide large equipment to direct participants in the Northern Territory because of the large distance. It's 4,500 kilometres from Sydney to the Northern Territory. So we can't provide the large items. We can provide smaller items that we can post. But what we have been able to do is donate a number, 26 items of equipment, which were primarily wheelchairs and bathroom aids, worth $133,000. That then goes to the statewide equipment service up there, and they repurpose it out to people in rural and remote communities. So the take-home messages from today are that people with MND have high and changing assistive technology needs throughout disease progression. A comprehensive equipment pool, such as FlexiQuip, enables equipment to be interchanged as people's needs change. And an extensive equipment loan library offering hire equipment to people with MND is significantly more cost-effective than single-use equipment and environmentally more sustainable. Thank you.
Thank you. As a regular user of the Victorian version, I can say I think you've done. Alicia is an OT who worked at an MND clinic prior to taking over this role, and certainly with the change in our funding, the MND equipment libraries had to kind of change a few things, and you've done an amazing job of bringing FlexiQuip into our new funding world. So thank you very much. It was amazing. Does anyone have any questions? I mean, I think environmentally, we've already had this discussion. We've already, as therapists, we're always talking about the wastage that some of our funding bodies kind of cause. And I know as an OT, we repurpose within our own little OT world that we live in. But go over there, babe.
Hey, Alicia. Susan Bromby. How you going? Great program. And from Tasmania, we also have a very similar program where we are. I did note, though, that your average equipment for NDIS was higher than your aged care, which is very surprising for those who don't know. Alicia pointed out that our NDS participants get a lot more financial funding than over 65, so that was quite surprising to me. Do you have a theory on that?
My theory on that is that the differences between our funding models for over versus under 65 is not just limited to assistive technology. People under the age of 65 have a lot more access to care and being able to be cared in the home for longer. So my personal theory on it is that people over the age of 65 are going into residential aged care facilities sooner where the equipment's provided. So if we had equitable access to care in the home, I would anticipate the equipment needs being very similar in the age groups.
I would 100% concur with that, because under the Aged Care Act in Australia, the residential aged care services have to provide a certain amount of equipment, and then above that is where FlexEquip or MND Vic would kind of come into that. So, does anyone? Oh, there's a question up back.
Hello, I'm Esther from ALS Switzerland. I don't have a question, but I just wanted to inform that in Switzerland we have a very similar system than you in Australia. And it was very interesting to hear that. And I just wanted to inform you that we have 2 storage rooms, one in the German part of Switzerland and one in the French-speaking part of Switzerland. And I just was interested in your big country, how many storage rooms do you have for your equipment?
We have one primary equipment service. We also store...
That's in just one state.
That's just one state. That's just in New South Wales. We have one main office, which is in Sydney. We also have a different section where we store our beds from a space point of view, and we've also contracted with a provider in a more regional area of New South Wales, and they hold some of our sub-equipment and will deliver out for us from there.
Okay.
And I think if you put in, I don't know if we can flick back to the Australian map, but where my mum was down in that bottom bit of the turquoise, so about 500 kilometres from the city. And if you go way up north in Western Australia, you know, it's like 18 hours drive. And what the MND WA have done a little bit is like partnered with local equipment suppliers, and Victoria have done that, New South Wales have done that, because just practically speaking, couriering stuff around Australia is impossible.
Where we're sitting in New South Wales, it's about a 10-hour drive up to get to the Queensland border and about 9.5, 10 hours down to get to Victoria.
Incredible. It's really impressive, because our longest drive is about 3 hours.
That's why for us 3 hours is around the corner.
We might not even get out of Sydney traffic in 3 hours.
Thank you.
Does anyone have... Oh, yep, couple of questions online.
We have a question online from Jackie Hill at the Neurological Support Team. She said, how quickly can you get items such as hoist out, which is Hoyer lift, for some other folks I had to ask what that was, to people? So how quickly can you get the Hoyer lifts out?
So if a person's already known to our service and they're already linked, in metropolitan Sydney, we can get it out within about 48 hours. If it's going up to a more regional areas, it's usually about a week.
Yeah, MND Victoria have similar turnarounds, and even sometimes even quicker if we really need to, because it's person-centred. So it's pretty impressive. Oh, one more question over there.
Thank you for a wonderful presentation, Naomi Fitzgibbon from the Irish Motor Neuron Disease Association. We have a similar bank of equipment, and I'm just wondering, is there any piece of equipment that you don't provide, and if so, why not?
That's something that we don't always provide. Some of the really low-level aid, so built-up cutlery, the lower-cost items, we don't tend to hold as many of those. And it has been a work in progress. I've been with the service for nearly 2 years, and we have expanded quite a lot. Something that we do regularly get asked for that we don't provide is stand-up lifters. There has historically been reasons around that, but that's next on my bucket list to try and tick off and add.
Have you got any OB robot feeders in the FlexEquip now?
We have 6 robotic feeders and one person on a waiting list. My background is in assistive technology and communication equipment, so we do have a lot of eye gazers and iPads, switches. Yeah.
She's done a fantastic job of bringing FlexEquip into our new world. So thank you, Alicia. That was amazing.